An epidural is shown on the left-hand side of the screen. It is a small plastic tube which is inserted into the back using a needle, which is later removed to provide ongoing pain relief during your labour. It is the only form of pain relief which has the potential to give complete pain relief and allow for the lady to catch up with some sleep. It is the safest form of pain relief in labour for baby. You can have an epidural at any point during your labour once you're in active phase, which is when the midwives tell you that you are over 4 centimetres dilated, or when you are on a pathway to delivery, such as the induction of labour. With regards to inductions of labour, if a patient is to require oxytocin, which is a hormone drip that the midwives refer to enhance the contractions, most of these patients will have an epidural at some point, as it does make the contractions quite a bit more painful. If you were to request an epidural in the very late stage of labour, such as when you are nearly fully dilated, we can still do the procedure, but you may not get full benefit from it before baby is born, as they take about 40 minutes for the epidural to be fully working. If you know that you want an epidural as part of your birth plan, we recommend that you ask for one early, as if we are busy in theatre, there may be a slight delay in providing it. And it will also allow you to sit in the correct position easier, as the contractions will be less intense and less frequent. The positioning for an epidural is either sat up with a pillow under your armpits, hugging your bump, like shown in the picture, or on your side, curled up in a ball wrapped around with a pillow. We perform an epidural in sterile conditions. We spray the back using a freezing cold cleaning fluid, and then require you to sit as still as possible for the procedure. You just need to let us know if you're having a contraction. The pillow positioning just helps you get into the right space and opens the lower back up for us. It's often described as the position of a banana or when a cat gets angry. We use some local anaesthetic to numb the skin, which stings a little bit, the same stuff that dentists use if you've had a dental procedure before. During the epidural insertion itself, you get a pressure-like sensation in the back while we find the right space. We then thread this tiny plastic tube into the back, which sometimes gives you a tingly or electric type shock sensation in one of either the back or the legs. This is very normal, it's nothing to worry about. You just need to let us know that it happens and try not to jump too much. Epidurals are incredibly safe. We do them many times a day, but they can be, like everything, associated with risks. Normally, they work very well, and when we come back to check on you, you're either asleep or happily browsing on the internet on your phone. They are only able to numb to pain, but it doesn't numb to sensation. So you'll still feel touch and pressure sensations during your labour. This is helpful because it allows you to know when to push when the time comes. There is about a 1 in 10 chance that your epidural will not work perfectly. That normally means that one side of the body is more numb than the other. There's normally things that we can do to improve this, such as putting you on your side or putting stronger medication down your back. But sometimes we have to take the epidural tube out and do it again to make you comfortable. There is a small risk of bruising and infection in the back, just by nature of putting a needle into the skin, but we keep it sterile in the same way that surgeons are sterile for theatre to minimise this risk. Epidurals often make you shivery and sometimes itchy. It's just a side effect of the painkiller that we use in your back. If the itching bothers you significantly, just let the midwives know. We can change the medication to one that makes you slightly less itchy, but most people aren't that bothered by it. Epidurals can drop your blood pressure by nature of how they work. We keep a close eye on your blood pressure, but if your blood pressure drops, it can make you feel a little bit sick. Just let us know, we can fix it quite quickly. You will often notice that your feet become warm and your lower tummy and your legs become tingly. This is very normal and it means the epidural is working well. Often, the bladder gets a bit lazy when it can't feel itself, so the midwives may need to put a little tube into the bladder once you're nice and numb, just to drain the bladder so it doesn't get overstretched. In terms of the significant risks with regards to an epidural, they are incredibly rare. There is about a 1 in 100 chance of a bad headache afterwards. We follow you up, and in most instances we can fix it if it happens. There's about a 1 in 1,000 chance of temporary nerve injury, which is normally an area of patchy numbness or weakness or pins and needles in one of the legs. There's about a 1 in 10,000 chance that this patchy numbness or pins and needles or weakness is permanent. There's about a 1 in 100 to 250,000 chance of paralysis. They're incredibly safe. We do them many, many times a day, but it can happen. There is potentially a slight increased risk of an instrumental delivery with an epidural. So this means either a forceps or a C-section. but we don't really know if it's a genuine association or just one of those things that would have happened anyway. For this reason, we don't allow you to eat with an epidural running, but you can drink any clear, non-fizzy liquids such as Lucozade Sport while in labour. The benefits of having a good working epidural in labour is that if baby did become unhappy and you would need to go to theatre quite quickly, it means that we can put strong medication down the epidural that's already there to make you even numb to facilitate this, rather than having to do an injection in your back in quite a hurry. So in summary, an epidural is a very safe way of providing you with very good pain relief during labour and, if needed, surgical intervention. They do come with risks, but thankfully these are incredibly rare and most patients will have a comfortable and uneventful labour and delivery.